Hello, I am Amy Rose Herrick, and I am America's Profit Building Specialist. We're going to be talking today about multi-generational family medical planning. Now, on this is based on the book that I've updated, and that will be released soon. For those of you who are joining me on the Zoom platform, there will be Q&A that if you'll put that over in the chat box, I'll make sure that I circle back around it. And the Facebook, sometimes it's a little bit harder for me to see, but we're going to go ahead and get started. Now, of course, I'll be putting down in the show notes how you can get in touch with me if you have some other questions or if there's some other things that you need. So let's go ahead and get right into it at this point. So what we're going to talk about today is multi-generational family medical planning. And when I get into these type of topics, what we're trying to do is to put this up, and you will see a replay that will be on YouTube, so that so many of these issues that come up, I've been requested to put them in print, put them in a video format so that we can help more families. And of course, we're all busy, and this gives us a chance to have another means to be able to do that. I always do a really quick disclosure for you. Understand that these are general concepts. And with this, what I'm trying to do is to give you some information. But of course, all of you have very unique dynamics. I would expect you to talk to professionals when you're putting some plans and things in place to make sure that we get the results that we're looking for. Now, what is multi-generational family medical planning? Well, exactly what is that? Well, what I believe is that every medical crisis within a family is going to affect at least 3 generations, because all of the resources will go to that individual who's in crisis. You know, whether it is grandma, it is a child, it is a parent who could also be a child, depending upon, what your circumstances are. The time, the resources all flow in that direction. And that's why I am pretty adamant about when you have a crisis. It could be a disabled child. It could be someone who has had a stroke. It could be an auto accident. It could be a chronic illness. Whatever the case may be, whenever we've got a medical crisis, indeed, it's going to affect 3 different generations of a family. And I'm going to kind of walk you through many, many different things that go along with that so that you can see how this makes a difference for the family members that are involved. Okay, I'm going to start with, we all know a Susan. And I'm saying this is Susan. Susan looks like a pretty normal gal to me. She looks like all the rest of us. Susan tries hard. But you know what? Susan had a major medical event in her life. She has gone through quite a bit of treatment, but it's not over yet. They've sold the second car. They've done everything they can at a garage sale. They're not sure they can hold on to the house at this point. She's not able to work. She doesn't qualify for unemployment because she's not able to work. Susan didn't have enough disability insurance. She thought health insurance was enough. Her parents and family have worked out, but Susan and her family is on the verge of losing absolutely everything. And what we find statistically is over half of the bankruptcies that are out there are due to medical events. And that doesn't mean a person didn't have medical coverage. It just meant that it's not enough. And it's only one piece of the puzzle that we've got to work with. So statistics, we don't always like them, but they don't lie. 78% or almost 80% of Americans at this point say they're living paycheck to paycheck. And some of these studies were taken before we had COVID to deal with, which did not improve any of the statistics on any of the newer data that's coming out. So any type of an interruption in income or medical expenses, copays, deductible, non-covered expenses, there's simply no room for them if you're living paycheck to paycheck. The other startling statistic that came up is that more than half of Americans spend more than they earn. This may be one of the reasons that you see recurring balances on credit cards and you're never able to get out of that hole. But that is an entirely different session. We're not going to be going over some of that today. Now, when you read some of the things that are on the slide, and I know you're already ahead of me, 50% have credit card rolling balances. Raise your hand. Nobody's going to see you but me. 40% have a mortgage or a car loan. 30% have student debts. And close to half have nothing saved to retirement, even though they may have access to a 401k or payroll deduct savings plan, or they could do it on their own. There's just no room. The other thing that I found rather interesting when I was compiling some new things is people think that when you reach retirement, these aren't issues that affect you, but that's not true. When AARP has done some of their studies, one of the things that was consistent, because of the enormous loads of student loan debt that can carry into later years and into the other generations, we are seeing the same type of difficulty financially with our retirees that we're seeing with the younger pre-retirees. What about personal finances? Well, we're going to talk a little bit ugly before we get to solutions. 40% of adults cannot cover a $400 extra expense. That's pretty scary. That's a little more than 2 people out of 5. How did that happen? Some of it has to do with lifestyle, but not all of it does at this point. This is probably one of the scariest statistics that I came across. And at this point, 28,256 annually is about the average, meaning some of you are paying more, some of you are paying a little less, for a typical family of 4. That's just over $2,300 a month. And another way I could put it, whatever you're earning, about $77 a day is going towards healthcare for a family of 4. Now, what are we going to do about this? Well, one of the things that we can do is we can be proactive. And there are 7 steps that I'm going to walk you through to help you protect your multi-generational family assets. Because if we lose the assets going to medical expenses, things that we could have avoided at that point, it doesn't leave as much for when you get into retirement, when you have other emergencies, or also if you're trying to pass wealth into other generations. And sometimes we've got to help each other a little bit. The first one, of course, is going to be health insurance. Many of you watching this have the ability to take care of a health insurance program that is through a payroll program that you have got through your employer. Many of you are entrepreneurs. You need to build your own. Some of you are using marketplace plans, but there are a variety of health plans that are available. And with those health plans, if you are self-employed, that often is an additional deduction that you can take off of your taxes. Many of you will look at your health plans and you think you can't afford anything out of pocket. And I've tried to change mindsets because of the enormous amount of money going towards healthcare premiums. You can often get over paying $1,000, $5,000, even $10,000 in medical expenses over time. What you will never get over is probably $100,000, $200,000, $500,000 medical bill. I'm going to encourage you to look and make sure that you're covering the catastrophic expenses, where the smaller expenses you can absorb. You could pick up a part-time job, you could sell something off, and you could cover the small expenses. So I want you to reevaluate what you're doing on some of your health plans. And if it's not anything that you've looked at for a long period of time, work with an agent to find out what's the best for your family dynamics. Here's an example. Let's say that you have a very low deductible, but you're paying a significant amount in premiums. Well, once you pay an insurance premium, if you never get a benefit back, you don't get a refund. In a lot of cases, you would be better off to have a high deductible plan, pay the lower amount in the premiums, and bank the difference, so that when you did have those odd years that were expensive, you'd have the money to pay for it. But once you pay too much in premiums, that money is gone. You're never going to see it again. A couple of other things. Step 2 is let's talk about prescriptions. There are programs that are available for you can have a reduced cost, or you could have free prescriptions. In the book, The Multi-Generational Family Planning, I put some of these resources in that you can look at. Sometimes your doctor will have coupons that can also reduce the cost. Depending upon your program that you have, you may or may not have great prescription coverage. There are also free discount drug cards that are available. One of them that I recommend is usdiscountdrugcard.com. You can go in at 50,000 pharmacies across the US participate in that. So there are different ways that we can bring down the cost of prescriptions. There are also websites and things that are available. Now, I purposely blacked out some of the names here because I just want you to understand the concept. There are websites that you can go to and you can put in your prescription, and in your geographic area, it will tell you how much those prescriptions are at different pharmacies, and the prices can vary widely. Just because you always go to pharmacy A does not mean that pharmacy A has the lowest cost for your medication. This is one of the tools that I have found can really make a huge difference on what you're spending on your medications just by shopping within an area. And maybe you've got to drive an extra 1 to 5 miles. But if the savings are anywhere from 10 to 50%, especially over the cost of a year, this is a huge amount of money that you can keep in your pocket and you don't have to give away. So that's one of the ways that we can work with it. Now, let's talk a little bit more on what we can do to reduce the cost of our prescriptions. How many of you ever heard of pill splitting? Have you ever even considered pill splitting? Well, what is pill splitting? What you may not realize is when a prescription is filled, there's always a cost built in just to fill the prescription, in addition to the cost for the medication itself. In a lot of cases, the cost of the medication, for example, whether you're getting a 10 milligram, a 20 milligram, 40 milligram, 50 milligram pill, is exactly the same. It's just that each pill has a slightly different dosage. In pill splitting, for example, perhaps my doctor has recommended that I have a 10 milligram prescription twice a day. If I'm filling it once a month, then I am getting approximately 60 10 milligram pills, and I have a price for it. Now, if I was to request that my doctor, because I've done my price comparison, change that to a 20 milligram pill that I use a little pill splitter to cut in half, then I've reduced the quantity of my prescription by half, and my costs are going to go down substantially. The other thing that goes back to what I was just showing you about some of that price shopping to see where you can get the best deal. There are many of you that with your health plans, you have the ability to do mail order. Mail order could drop your prescriptions, but make sure that you have a consistent program so that you don't run out of pills and they're not in the mail. And because we've had some interruptions in mail service because of COVID and the ripple effects, you may need to plan a little differently. That leads me into my next suggestion, and that has to do with 30-day versus 90-day refills. What many of you don't realize, again, going back to the cost of filling a prescription, you're used to going in once a month to get a prescription filled, but that may not be the least expensive way for you to fill the medication, especially if it's something that you're going to be using on a long-term basis. If you were to price out 3 30-day prescriptions, and thinking about you're going to have to take 3 trips to the pharmacy to get it versus a 90-day prescription and what the cost is there, you can often see significant savings. And again, you may have to ask your doctor to change the prescription to a 90-day refill. I've seen some individuals on maintenance med, if they have a relatively long shelf life, that have gone to 6-month or 180-day prescriptions because the cost savings were substantial. And when you start multiplying this with every prescription you have, you can certainly see that there will be a difference there. Now, what about step 3? You know, insurance comes in a lot of different forms. We can have disability insurance, long-term care, critical illness, air ambulance, cancer-only indemnity. I mean, there's a very long list. And what might be the correct configuration at your house may be completely different from mine, because my family dynamics can be different in the age, illnesses, prescription requirements, and basically what their overall health could be. Now, there is another option that many of you are not aware of, and it's called a Medi-Share ministry. But either way, you want to work with a professional to find out what is going to be the best option for you. I'm going to touch briefly on long-term care because, again, this goes along with multi-generational family medical planning. Whenever we have a generation that needs long-term care, and I'm telling you, this is not always folks that are in your 70s, 80s, and 90s. I've seen this in much younger cases too, again, depending upon some health issues or accidents that have occurred. The question always comes up to me, how long should I buy a long-term care policy for? Or some of you are looking at the hybrid that is a combination between life insurance and long-term care because we have a guaranteed benefit whether you are going to receive the long-term care benefits out of the policy, life insurance at the death of the insured, or some combination of the two. This is a little chart that I found. The most recent one I could get my hands on was 2018 to give you an idea. So if we go by the percentage of claims by age and then the duration of the benefits, you can see that if I go to the first column, for example, a person who is 55 to 64 years of age, 72% of people 55 to 64 are going to need some type of long-term care or assisted living or some type of assistance on average for 3 months. Now, when you start looking at the older ages and you start looking at this, you can see that on the 55 to 64-year-old, the 5-year mark at 60 months, there's still about 15% of the people who are going to need that. Statistically, you are at some point in your life will require some type of long-term care. Maybe that long-term care is a person who is assisting you. Maybe is it in a facility. Maybe it is someone that is helping you in your home. But when you're looking at coverage, because there's a fine line between what is not enough and what is enough, you want to talk to professionals because we can put some mechanisms in place to protect family assets so that you don't have to spend down to zero. But this will give you a guide based on your age, or if you're looking at some of your parents' ages or grandparents, of what is the reality that this is something that is going to significantly impact the financial viability of your family. This one is a little surprising for some of you because there have been some changes. For those who have spent down their assets or have gone down to where now they are using some type of a state type of assistance that is paying for the long-term care, which can be difficult. And in addition to that, in many cases, the facilities are not readily available. They can be limited on how many beds are actually available, and that could also limit where those beds are. Let's take, for example, I lived in Kansas for many years. If you look geographically at Kansas, yes, Kansas City, Wichita are relatively large cities and areas, but there's a lot of area in Kansas with long-term care homes. But I may have a parent or a grandparent that because of having a bed available, that it is a 2.5 or a 3-hour drive, and they may not have family available, but that's where the care was. Where some of the surprise came along was that in an example that was a court case in Pennsylvania as early as 2017 is when some of this started, and it's been continuing on. The state went back and sued the heirs to reimburse them for the cost of the care of their parent. This was very eye-opening. But along with this, it's something that is being looked at by other states because the cost of caring for our elderly is significant. And if the intent was to pass assets on to heirs so that their estates were left intact while the state picks up the bill, this isn't going to last forever because there's only so much money. What they established is that the children have a duty to care for their parents. That was the basis for this particular lawsuit and going forward. And so it's something I want you to be aware of. Even if you're making the changes, that does not mean that the world is not changing, where they may come back and sue the children who should have taken care of their parents to recoup this. Again, this is some information that can be rather eye-opening, but we need to be having these kinds of discussions. You ever heard of air ambulance coverage? I haven't. Some of you may not have heard of it. Of course, I live in the Caribbean, so being able to airlift off island is important to me. But air ambulance coverage is often used when you think about somebody who was at a crash site and you've seen the medevac type of helicopters. Well, that's a type of air ambulance that whether you're in the Caribbean or you're abroad on a vacation or you've been in an accident in a remote area or maybe it's congested, whenever you use an air ambulance, those rides can be extremely expensive, even for a short ride. You're talking about $25,000 and up just to turn the key. Think about that. You need to check on the policies that you have. And I've seen many health insurance policies that only have up to $10,000 of air ambulance coverage. If you live in a remote area, you travel a lot, this may be something that you need to incorporate in order to protect the other assets you have, but then to also assure that you have got air evacuation out of an area in an emergency that you are not going to have to pay for. But then I always want to have a backup plan. Depending upon the company that you work with, and there are more than one, I have my preferences. You're certainly free to reach out to me if you'd like to have more of a one-on-one conversation. But let's say that you apply for air ambulance coverage and you're turned down. You are not eligible for coverage. Sometimes there's workarounds for that. Sometimes they're not. But one of the things that is available is if you are not eligible for that, you ought to have a backup plan. And you need to have your family informed of this. With a backup plan, you in a computer, again, if people are traveling, you may want to have this in a shared folder that's on the cloud so it's current. You probably ought to have copies of passports. Who are the physician contacts? What are preferences? What about health insurance IDs, your date of birth, all of those types of things, so that in the event of an emergency or somebody has got to access or may have to make the arrangements, that they have the ability to do that. Now, what I can tell you is that if you are on Medicare, on some of the Medicare plans, they will pay for transport to the closest facility. For example, I live in the U.S. Virgin Islands. My closest facility may be Puerto Rico because it's only about 90 miles away. I may want to be treated stateside where my family is or where they have larger facilities, or in Puerto Rico, there is a lot of Spanish that is spoken. If I'm not bilingual, that may be a hardship for me. But you need to know where your gaps are with what your lifestyle entails. Now, SkyMed is a company that I'm going to mention because they do offer a rather unique service. If you do not qualify for coverage, they will go ahead, and if you request them to, they can help put in place medical flights. They can get the bulk rates because that's one of the things that they do. I did put the contact information that is up on place. They do sell air ambulance plans, but again, if you don't have one or the person doesn't have one, this might be a resource that would be very helpful to you in an emergency. It's not going to make it free, but this could dramatically drop the cost there, and you can secure it with credit cards. There are ways to do that, but it's a resource you need to know about. Let's talk about some other insurance products that you might have. There could be disability income replacement. I touched on long-term care, air ambulance. We're going to be covering those separately in an entirely different session, where I go over the individual coverages and what they will do and what they will not do for you. But it's all part of the program of trying to protect your family throughout the generations and having some of the right pieces in place. How many of you have heard of a Medi-Share ministry? I belong to a Medi-Share ministry. I mentioned I lived in the Caribbean. We are not eligible for the ACA or the marketplace plans. And this has been an option that has worked very, very well for me since 2017. It's not for everybody, but it's an option that you should be aware of because for many of us, it works extremely well. And the costs are significantly lower than what I may have seen on a traditional plan. So you should be aware of it. Now, with the Healthcare Sharing Ministry, these are nonprofit organizations that are built on biblical principles of sharing the medical needs amongst the community. And in this case, it's the members of the Medi-Share ministry. Now, with that, you would agree to a certain set of standards of conduct. And there are principles there. If you do not agree with the covenants or the principles in that organization, then it's probably not going to be a good fit for you. However, for many, it is. And I want you to start thinking about how, for many of us on health insurance, to me, it's like a great big comfy quilt that covers it all. Now, on this comfy quilt, some of you are using your group health insurance programs. Well, I'm not eligible for that, but I don't want to take that square away from you because it helps cover you. Now, others of you are picking up policies that are on the marketplace. Well, I don't want to take that away from you, even though I'm not eligible in the Virgin Islands, because that square helps cover you. Some of us that are older have Medicare. Well, just because I am under the age of 65 and I'm not eligible for Medicare or a Medicare supplement, that doesn't mean it's a bad program, because that square covers someone else. When you start thinking about all of these different coverages and Medi-Share Ministries, even if it doesn't fit you, even if you are not eligible for it, it still is part of that patchwork quilt that covers all of us. And I think it's essential that we have as many squares to choose from as possible, because all of our dynamics are very, very different. Now, on the slide, I had put up some of the larger ones. The other reason that these names are important is that at the time on taxes, when you were levied an additional tax if you did not have adequate health insurance, these were the Medi-Share Ministries that were exempt from that. If it is resurrected, those are some of the things you would need to know so that you would not be penalized on your taxes. So that gives you some ideas. And again, if you have additional questions, you can always reach out for me on how they work. They work very similarly to insurance, but they have different terminology, and they may have a little different processes between the different companies. Some of them will pay the proceeds from a claim directly to the provider, which is what most of you are used to. Some of them will reimburse you for the expenses, or it might be a little bit of a hybrid situation. So again, it varies, depends upon the Medi-Share Ministry and what they cover. But one of the other things I found with the Medi-Share Ministries is that you do not generally see the increases that I have seen happen with the traditional plans. I'm going to speak to Altrua because that's the one that I use personally. That is the one that I have the most experience with. One of the things I found very attractive about Altrua is there was an 8-year period where there was no increase in what the contribution was per month until they added benefits. And when they added benefits, we all gave some input. They increased the benefits, which increased the amount that we paid monthly. I was okay with that. We had another increase that just came up at the first of this year that was very modest. It was in the single digits for my household and the family policy that we have, because the cost and things have changed and benefits were added once again. So with this, I found it to be an affordable option. Again, if you're not familiar with the Medi-Share Ministries and you're strangling over some of what you're paying for premiums, probably something that you ought to be looking into. I'm going to reiterate, this is a Medi-Share Ministry is not insurance. It is a not-for-profit based institution, which makes it very different. I am not picking on any insurance companies. I work with a lot of them, but they are for-profit organizations. They have stockholders and they have different ones that want to see that element is taken away in the Medi-Share Ministries. They're not for everyone. You need to pre-qualify to join. Unlike some of the marketplace policies where everybody is eligible, they do have statements of standards and it's portable. So let's pretend that you picked up a Medi-Share Ministry and you're living in, I don't know, North Carolina, and you decide to move to Idaho. And then somewhere in this process, you decided that you were moving to Montana. Maybe you pick Kansas or Texas. This is portable. The other thing that is different with the Medi-Share Ministries is they have open enrollment all year. So you don't have to work through just a little bit of a window. They are exempt from the Obamacare type tax mandates. For those of you who are watching who are retirees, most of the Medi-Share ministries also have supplemental plans that are available that would be over and on top of your Medicare, which still acts as your primary. Let's talk about step 4, health. We've got benefits. Some of you in your companies have health savings accounts. They might be known as HSAs. You have health reimbursement accounts, which are HRAs. What about pre-tax plans that are like Section 125? Some of you call it a cafeteria plan. This enables you to set aside a portion of your payroll that is deducted pre-tax, so you don't pay your state, federal, or Social Security and Medicare taxes on it. And it is set aside an account. And when you pay for medical expenses, it reimburses you for those expenses. That can be very helpful. Depending upon your tax bracket, you could easily see savings of anywhere to 17 cents to maybe 47 cents on the dollar by paying for your medical expenses through some of these programs. If you don't know how they work, if it's good for you, talk to your HR person or talk to your tax professional who can give you an idea of how this may work in your household. Most of you are not able to deduct your medical expenses with itemization, so this is an excellent tax savings tool, which helps you stretch your budget just a little bit more. Health savings accounts for 1040, we have 2022 limits because that's when this is being filmed. Now, on a health savings account, that goes with a high deductible plan that you have. Now, a single individual could put up to $3,650 away. A family, $7,300. Now, if you're over 55, it's what's called a catch-up provision. You get to add an extra $1,000. Now, these amounts are taken off of your income tax return and what's called above the line before your deductions. So if you are paying income taxes, these amounts will not be subject to your federal or your state income taxes when you put the money in. Now, the difference with the HSA is I don't have to spend all that money this year. If I let that money set for 5 or 10 years, and then suddenly I needed to have a lot of dental work done, my child needed braces, I decided to have laser eye surgery, whatever the case may be, I could use those funds and I do not pay taxes on them as long as it is used for medical expenses. I have many individuals but put these funds away and they plan on using them after retirement and letting them accrue tax-free because they can. The other thing that goes along with these plans are usually very easy to use. You may get a little debit card that you could present at the time of service, or you can reimburse yourself and you can get a cash withdrawal taken off at the bank. Usually there's a limit on that of $1,000 or $2,000 a day, but very, very simple to use, very simple to leave for out into the future for an additional retirement income source if you really don't need it now, or a way to pay for all of your expenses at a lower rate because of all the tax savings. Now, with that, we also have health reimbursement accounts. These are done through your employer. I don't see these used as often as they probably could be. Now, with that, the employer agrees to reimburse their employees with non-taxable dollars in order to pay their medical expenses. And the employer gets to deduct this from their business expenses. So this is a win-win. The employer gets to deduct it and they don't pay income taxes on it. The employee gets to receive the reimbursement and they don't pay taxes on that income either. Now for 2021, you're going to see that a family monthly could have up to $891.67. And for 22, that jumped up to $920 for a month, or a little over $11,000 a year. So if an employer switched over and was doing something on a high deductible plan, in lieu of an HSA, maybe they put in place an HRA and they help overcome some of the larger deductibles for their employees by being willing to do a reimbursement. Now, I will tell you there's one little negative side to this that I've heard from some individuals. When you turn this in, of course, there can be an issue of privacy. If I turn in a medical bill after it's been paid and I'm showing the amount that I need to pay so that my employer could reimburse it, depending upon what's on the receipt, of course, it's going to have the provider, whether it was a hospital, a doctor, a counselor, medication. Some aren't so happy about their employer having that, but you need to outweigh the risks versus the rewards and understand that, again, that information will be kept confidential. It's not anything that's going to be shared, but the employer does have to have a record in their records in the event of audit or any type of check to verify that it was indeed a legitimate medical expense that was reimbursed to the employee. It could cover eyeglasses. It could cover dental work. It could cover acupuncture, chiropractic care, co-pays, deductibles, really a lot of flexibility within those programs. Now, when you talk about an employer-sponsored pre-tax plan, such as a Section 125, you notice the limits are substantially different. It drops down all the way to $2,850, which doesn't necessarily go very far. You do have the opportunity to carry over up to $570 a year. So let's say you put the full amount in, but you didn't have as high medical expenses as you thought. You know, there's a lot of people at the end of the plan year suddenly need eyeglasses. They're filling a couple of months worth of birth control pills, whatever the case may be. They're getting their teeth cleaned to use the money up, but you just didn't need to. You can carry a little bit over into the following year. So again, you know, you want to plan this, but has a little lower limit on this one. With that pre-tax, once again, you're not going to be paying state, federal income taxes and your Social Security. So the money you put in here actually goes a little further because of the tax savings that you had. Now, you know, I'll call it a learning opportunity for my employers. You know, I'm an employer. Is there something else I should be aware of here? Well, how do I save monies? Remember that as an employer, if you do not have some of these plans put in place, if you have a cafeteria plan, for example, when your employees participate in this plan, it reduces the amount of Social Security matching that you have to pay in as the employer on their wages. In many cases, the cost of administrating the plan is easy to overcome just with the cost savings of what you did not have to pay on your matching Social Security and FICA taxes. You want to talk to your tax professional, and they can give you a little more information on that and help work the numbers to see if that's something that would help increase your bottom line and be a benefit to both you and your employees. Now, other thing I want you to understand that employer contributions to an employee's health flexible savings account are not limited to the $2,850. And again, this is something that I'd like you to talk to your tax accountant or your tax preparer about so that you can structure a plan that works for you, because employees and employers are on little different sides of the fence, but we both are neighbors and we need to do things that work for each other. So engage professionals so that it can benefit everyone. And the only one in these cases who loses out is the IRS, who is not collecting the tax. But in some ways, we all feel like we win when we do that legally, morally, and ethically. Let's talk about step 5. We got to have some important documents in place too before you need them. Most of you are familiar with a will. You have a financial power of attorney, medical power of attorney. You know, there's other non-legal sources that are available. And so I'm going to touch on a couple of these just a little bit briefly, but this also goes along with a completely separate session that I have that talks about legal documents. Why do I need those now? That I can spend a little more in depth. The Family Love Letter. This is an excellent resource that I have found. Donna Pangano, lovely lady, who is the one who is the author of this particular piece. I just put it up. What the Family Love Letter is a place that you can compile a lot of information if somebody needs to step in a crisis, whether it is from a medical power of attorney or a power of attorney. And it helps you put a lot of things in one place. And it also helps you put down what some of your wishes are, what are passwords, what are your insurances, lots of information, a very, very affordable resource. In some families, what I've encouraged them to do is to order multiple copies so that everybody fills one out and we make sure we know where those copies are. Now, if you do not want to pay for a resource, as nice as it may be, this is another resource that I found. And it's a digital resource, meaning that you can go on their website, you can download it, and you can have this. Now, this was originally developed for police officers so that if they are killed in the line of duty, they have specific protocols that are set up for the clergy, officers that are going to assist, and other things to put in place for their family, funerals, and other things for that law enforcement community to come around the family and to support them and to also make sure that they are taken care of. But an excellent resource that you could use if you were looking for a free resource. So they're out there if you just take a little time to put them in place. So what about step number 6? We're getting down on our steps. Your crisis medical plan. Well, you've got one, right? Because what we were looking at before on some of the statistics tells me that, well, no, you probably don't have a crisis plan, but it's never too late to put one in place for when you need it, because it's a lot harder to try to figure out a crisis medical plan when you're already in the middle of the crisis, or your parents, your child, adult child, grandchild are. So we're going to talk about a couple of ideas on what you can put in place for that. Where does the money come from? All right. Some of you may have a credit card that has no balance on it. At an emergency, that could be a place to go. But of course, we're always going to have to pay it back. And we need to look at what the rates are. We don't want to do cash advances, which will be the most expensive way for you to access that money. In addition to the cash advance fees, which can be anywhere from 3 to 5% normally, usually the interest rates are well above in the 25% rates and in that move. What about savings? Do you have savings accounts that could be liquidated very, very quickly? Could you sell something, even if it was at a fire sale pricing? Could you get a loan? Well, that depends on if you qualify. If you are off work for a significant period of time and you don't have an income coming in, don't have disability insurance, you're not on Social Security, you may not be able to qualify for a loan, or you may already be at a point, which is a different session, where you've got 36 or 40% of your resources are committed to installments, and there you really can't qualify to borrow any more money. You could potentially borrow it from a 401k if you can, but this assumes you've got to pay it back. And if you separate from the employer, all that money will be due, usually within 30 to 60 days, or we've got to include it in your taxable income, which can be very expensive and only exaggerate the problem that you already have. You may say, oh, I'll just cash out my IRAs. Maybe yes, maybe no. Depending upon what the value is and where you have that money invested, you may lose money at the time of liquidation, or you may not. Depending upon your age, you may have an additional 10% early withdrawal penalty if you're under the age of 55. Or you may have to include this in your taxable income, and you could lose 20 cents to 37 cents on the dollar, because we look at this as being the last taxable money coming in the door. And so it will be taxed the highest. And of course, if you live in a state that has state income taxes, well, those would also be due on the withdrawal. Now, we could potentially take the money out of a Roth IRA, assuming you had them. Now, on a Roth IRA, we would be able to withdraw money from it up to your basis, which means the amount of money that you have contributed or that you have converted from an IRA to a Roth. That's your cost basis. So let's pretend I had a Roth IRA that between the amount that I'd put in it and conversions, my cost in the Roth IRA was $50,000, but it's worth $75,000. I've got $25,000 of gains. Even if I am under the age of 59 and a half, I could take up to $50,000, my basis, out of my Roth IRA, as long as I do not touch one penny of earnings. And I've got to communicate this with my tax preparer, and I need to have records. And I would not pay income taxes or penalties on the withdrawal of that money. So I often earmark a Roth IRA, if we can, as being a potential source, because it can often be the least expensive for us when we take the tax liability out of it. You could beg from others, Maybe you can declare bankruptcy, but bankruptcy does not make everything disappear for you either. So what is your crisis plan? And it may have multiple steps that you've got to work with. Trying to find my little arrow here. Let's talk about another one that most people don't ever think of, a clinical trial. Now, with a clinical trial, of course, you've got a significant illness or injury. Something has occurred here, and clinical trials are not available for everything. Clinical trials generally include some type of a treatment. They will also have medications, but there are responsibilities on being in a clinical trial. One of the things that you need to understand in a clinical trial is on many situations, there are some of the individuals in a clinical trial who are not going to receive the medication. They're going to receive a placebo so that we have a test group. So going into a clinical trial may or may not be an option for you to help pay for or enable you to receive medical care. But you need to go understanding what the parameters are and whether you have a chance to receive the placebo or if everyone is going to be on the medication at that point. But it is an option that many of you don't usually think of. Now, I want to impress one other thing upon you. You know, there are 4 kinds of people in the world. Those who have been caregivers, raise your hand if you've ever done that. Those who are currently caregivers, raise your hand or it may still be up. Those who will be caregivers, look around. Everybody's hand should go up. And those who will need caregivers, you need to leave your hand up or put it up, because at some point in your life, all of us are going to need caregivers. And that was from Rosalind Carter. And I thought that was a very wise statement that woman made, because caregivers impacts every one of us, regardless of your age, your geographic location, your financial, your religious affiliation, political, your age. It doesn't matter. We all, as a human community, have this same thing in common. Now, we also have some special considerations that we're going to spend a couple of minutes on. You know, what about our physically disabled family members? Some of us have mentally disabled family members. We've got incompetent family members. We got cohabitating households, and that is not just 2 people who are not married. We've got divorced families with children. What about a special needs trust? Do you even know what that is? Respite care. Who is the primary caregiver? You know, these people need a break, and we've got to have a plan for primary caregiver relief. And we also have to have some written instructions. So if the primary caregiver is suddenly taken out of the picture, whether that is from an accident, an illness, or death, someone needs to step in to be the caregiver, and they really need a roadmap to make it easier on the person being cared for and also the person who is providing the care. So now it's time to start protecting the ones you love when you start making the plan. And in the back of the book, the Multi-Generational Family Medical Planning that will be coming out soon, I have the charts and I have some things to help you build out the plan that makes this easier so we don't miss things. So it can be done, and I believe in you. And with a little bit of help, this is something that does not have to devastate your family. It doesn't mean it won't happen. It means that when it's happened, you've got a better ability to cope with it and to make it go a lot smoother for everybody. I want to give you the quote: when you fail to plan, you plan to fail. And we are not going to fail to plan, because now we've got some tools. And one of those tools includes knowledge that enables you to have a different result. I mentioned that in the book, the old copy is up. It's Family Medical Planning right now up on Amazon, but the new one will be coming out soon if it's not up already when you watch this in the replay on YouTube. In the back of the book, as I go through and I talk about in depth all of these different issues, you're going to see that we've got a checklist. So that as you go through the book or towards the tail end, you can check off the things you need, the ones that you have, because I'm believing that you have some of these pieces, but maybe you just need to finish your plan out a little bit. And what should be given to your power of attorney so that they have got copies immediately in their hands. A couple of things that I have seen when you need to distribute the power of attorney copies. One individual was rather enterprising. They happened to have parents, but they were in opposite directions from parents and in-laws. But they knew they would always be jumping in the car, whichever direction they would go in. In the back of the trunk, in a Ziploc bag, they had powers of attorney and some other things that they kept in the trunk with the intent that they would always jump in the car, whether they were going to one parent's or the others, and they would have the documents they needed if they needed to use them. I thought that was rather creative on their particular dynamics and circumstances. A lot of families are using a shared folder on the internet. Maybe you are using Google Documents. Maybe you're using Dropbox. Maybe you're using some other method, but a shared folder enables you to have it. I've seen a few people that have put that into an email that they never delete. Some people aren't as comfortable with that because of hacking, but in your family, figure out what works and make sure that everybody has access to this type of information. Now, I know we have covered a lot of things in an hour. So we're going to go into some of the Q&A. Now, for those who are joining me live on the Zoom session, I'll be exiting out of this and we'll take care of that. So let's go ahead and exit this screen, and we're going to stop sharing so that I can come back up. This will be available up on YouTube relatively quickly so that you can go back in. Feel free to share this with others. Now, I'm going to go ahead and repost over in the comments. Now, there on YouTube, if you will look down in the show notes, you will have some of these that will be posted there. Please feel free to reach out. If you will look, I have other titles that are available. You're welcome to watch. You can also go either to my LinkedIn or my Facebook calendar, and you will see other sessions that will be coming up. I have one series that is for individuals, which is what this fell underneath today. And then I have a different series that is for entrepreneurs and business owners. So I am Amy Rose Herrick, your America's Profit Building Specialist. Those on YouTube, thank you for joining.